Welcome to the Personal Edge Fitness Podcast
with Garrett Williamson.
Health, wellness, exercise, nutrition, and a whole lot more. Got questions? Call us and leave a message at 251-278-EDGE or message us at Personal Edge Fitness on Facebook and Instagram, at Team PE on Twitter, or PersonalEdgeFitness.com.
This is Garrett Williamson. Hey, we had a change to the program anyway because of the events going on. It's kind of the elephant in the room, so we might as well discuss it. A lot of people under stress. I understand that. All of us are going through very unique times here, and something I've never experienced in my 52 years, and definitely not experienced in my 20 years in business. So it's new, it's different, it's a challenge, but I'm more than certain that we're going to get through it. But I thought, since this is a health show, and this is something that my clients are talking to us about a lot, then they're concerned, just like I'm sure you're concerned. And so I thought we would address some of the issues of that, and especially when it deals with what we're doing to combat it, because there's plenty of negative talk about. We could sit here and dwell all day on the negative, but I don't think that's really going to get us anywhere. So what I thought we would do tonight is let's talk about some of the positives. I thought we would kind of discuss what we can do during this time, especially dealing with COVID-19, how we can protect ourselves and how we can mitigate this, handle this, because we're going to get through it, obviously. And I'm so proud to see communities banding together, this nation really banding together, and it's something that's uniting us. Believe it or not, it may be we'd much rather not have it. I'm sure all of us would, but there's a unique situation we have, much like every time we face a major crisis. We had this in 2001 with 9/11. And we had it here on the Gulf Coast with Katrina. It's amazing how incredible stories of communities uniting and people working together. We're seeing different faiths uniting together. We're seeing different groups unite together. We're also seeing, believe it or not, government working together and making some good moves. So I thought tonight we would talk about this because this is a stressful situation. And if you're a fan of the show, you've heard me talk about stress. It's one of the major reasons that tend to make us, quote unquote, gain weight. Actually makes us overeat. We're trying to mitigate stress. We're going to talk a little bit about that tonight because this is a very stressful situation we're going through. In fact, my Catalyst group that I'm working with right now, we do talk a lot about stress because the reason we gain weight has nothing to do with food. There's no such thing as bad food. You've heard me say that several times. The reason we do such things is because we're trying to mitigate a feeling. We're trying to deal with something that's going on in our brain. And one of the biggest things is, of course, stress. And this is probably one of the most stressful times I've ever seen in my business in my life. And so we're actually talking about that. We were talking about this with the guys in my program last night and dealing with how they were looking for ways to mitigate it. So we're going to talk a little bit about that tonight. We're going to talk about immune systems. That's a big player in all of this and something that most people don't know a lot about. And if it makes you feel any better, and maybe it doesn't, but the science doesn't know a whole heck of a lot about the immune system, but it's something they're studying every single day, and we're going to talk about some of the things that we know about the immune system, some things we can do to help the immune system. You hear about bolstering the immune system. Well, it is a system. It's not just one entity. It's not like growing a muscle. I have a tough time with curls, so therefore I'm going to bolster my bicep. It's a system, but I'll like your body, which you've heard me say many times is the most amazing machine that you'll ever encounter. It's a system, and so this is one big system, and it is the immune system. We're going to talk about ways to work with that, and I'm also going to talk in the beginning here about resilience. This is something I talked about 2 weeks ago when this crisis really hit this area. It hit, of course, the United States, but it really hit our area a couple of weeks ago, and things really started to change. And I talked a little bit about resilience, and if you don't mind, I'm going to share that again because I think it's something that we all need to keep in mind. Now, I'm not jumping at this by myself. I do have a master's degree in fitness management. I have a bachelor's degree in exercise science. You've heard this resume before. I've been a personal trainer for 29 years. I run the #1 personal training facility in the state, top 10 in the Southeast. We do anything in fitness and sport that's not illegal, immoral, or fattening. So we're in the health field, and this is something we work with all ages from 7's our youngest client up to right now currently 90 years old, and 35% of our clientele is over the age of 65. Even though I have that kind of experience, I need a little help on this particular topic, and I'm not going to act like I know all about it. And tonight we have the record for the number of guests that we've ever had on the Personal Edge Fitness Show. In fact, we got some fantastic minds on this, and I'm very privileged to call these individuals friends of mine, and I'm very, very privileged to have these individuals on the show tonight and help us out dealing with this. We have a physician you've heard me speak about, believe it or not. It's going to be joining us out of Chattanooga, Tennessee. We have Dr. Lori DeLong who's the Dean of Health and Sports Sciences at the University of Mobile, is going to speak with us, and our good friend and my go-to dietitian, registered dietitian Lynn will be joining us also, all talking about the immune system and aspects of COVID-19 and some of the problems that we're facing. I told you I wanted to stay positive with this, and I just don't see any benefit to being negative. I think staying positive in this is one of the best ways to mitigate the problem we're having. And I just want to relate this to you. I just want to tell you this. How about that? I want to go through something I talked about a couple of weeks ago, and it deals with resilience. It's something we need to keep in mind for our nation and for our sanity. And with all the craziness and uncertainty of this recent eruption, we're confronted with the idea that this has never happened before. Really? This nation has seen all challenges. It was launched in 1776 to adversity. It was attacked in 1812, 1941, and even as recent as 2001. Between the years of 1861 and 1865, we actually tried to destroy it ourselves. We've been criticized, both foreign and domestic, separated by race, national origin, sickness, and even faith. Financially, we were almost ruined in 1929 when the GDP dropped to 26.7%. Before that, it had dropped 29.7%, and in 1893 at 31%. Most recently, we all remember 2008. We've had outbreaks of smallpox, measles, yellow fever, polio. The nation shuddered with the onset of each of these diseases, faced closures, economic ramifications, and even quarantine. Folks, we've won wars. We've cured diseases. We've landed on the moon. We've seen Mars and reached the heavens beyond our solar system. This is an amazing nation. With this as with other challenges, we all need to keep in mind an early 19th century saying for all times. This too shall pass. And globally we're at war, but for the first time we're all on the same side. We have the same foe. To start us off, I figured we'd go to the medical field, and I could think of no better than a fantastic internal medicine physician out of Galen Medical in Chattanooga, Tennessee. Let me give you this gentleman's background a little bit. He's a graduate of Alabama Medical School. Actually before that, he was a cum laude graduate of Birmingham Southern. He's originally from Mobile, practices up in Chattanooga, and has a beautiful wife, 2 fantastic kids. He's also an incredible athlete. I like working with the physicians that are very active, and I'm blessed to be surrounded by a lot of them. We have a lot of them here in the Mobile community, and this guest of ours is no different. He is an accomplished cyclist. He is a fantastic swimmer. But on top of that, because of those things, he happens to be a multisport athlete. In fact, he is a 2-time Team USA ITU World Championship competitor. Now, that's a mouthful, but that's an incredible accomplishment. He competed not only in one event, but in 2 events. He was a sprint triathlete in 2011 in the Beijing World Championships. He's also a competitor in the aquathlon, which is a run, swim, run event in London in 2013. On top of that, he's an Eagle Scout, but his proudest achievement to date has to be being my brother, Dr. Ivey Williamson. Dr. Williamson, welcome to the show.
Well, thank you, Garrett.
I know you have to agree with that resume, so we won't even question that, especially that last bit. So I think it's about 12,
yes,
page
totally
12 on your resume. I know it's got my name all over it. So I was called about the endorsing rights on that. So hey, thank you so much for joining us. And actually, all kidding aside, you're in the internal medicine field, and you and I've been talking a little bit about this, and you've been greatly affected by this, like a lot of us. I know your practice has been affected. But let's talk a little bit, if you don't mind, about what you're seeing with this virus, and a little bit about the differences between this and the flu, these kind of things.
I think that people are finding out now that this is definitely a much more serious illness than influenza.
Right.
Influenza, no question, it kills people, unfortunately, in large numbers every year. But this virus is a lot more sneaky. You can be a carrier of it and not be showing any symptoms.
Wow.
For up to a week or 2, right. Even. So it's not like when you get the flu, you wake up one morning, your body hurts, you feel like you've been run over by a truck, and you've got a terrible racking cough. Coronavirus doesn't work like that.
Right.
That's why these isolation procedures that they're trying to get out are just imperative to preventing the spread.
Right, I understand, definitely so, and I'm sure that all of my listeners and I'm sure all of us are remembering to keep that in mind. And they've actually got not a shelter in place here in Alabama, but they've limited to non-essential workers or employees or what have you going into work. So we're kind of trying to lessen that curve, definitely. So, but in your excuse me, in your practice, are y'all doing testing yourselves, or is this going to the individual practices in Tennessee, or how's that going?
Galen is doing drive-by testing right now.
Right.
We were fortunate enough to have the testing materials, and one of my partners has been spearheading the effort to make this occur. We had attained a grant from Medicare several years ago. We had some additional funds that were specifically allocated for providing procedures that we didn't already offer in the office, and this obviously qualifies for that. So
Sure.
we set up a drive-by system where patients who are screened, and then they have an appointment time where they drive through, and our staff in personal protective gear actually swabs them, and they drive home and are told to quarantine
Sure.
until the results come back.
Right. Right, I understand. Well, let's talk about some surviving this virus. If you were to contract it, first thing, but I'll tell you what, before we get to that, excuse me, I probably should not put the cart before the horse. Let's talk about prevention. You're talking about the standard thing that we're hearing from the CDC, we're hearing on the news, we're hearing from health professionals such as yourselves. They're recommending the social distancing, washing your hands, and basically keeping yourself protected that way. But I'm talking about immune systems tonight, and one of the things that CDC is recommending is not only the different recommendations there, and as I reach up and try to scratch my forehead and trying to remember not to touch my face, but staying active during this time. How does that aid in the immune system or in what we're dealing with here? Why would they recommend such a thing?
Well, getting outside, at the same time, social distancing
Right.
definitely helps people fight off illness. It's been shown to help improve your immune response.
Sure.
And there's also studies, especially in older adults, where when you receive vaccines, you have a heightened immune response to the vaccine.
Sure.
So hopefully that's forthcoming for Corona as well.
Right.
But staying active is definitely part of your armamentarium.
Yeah, I'm sure. Well, and I'd look at it, of course, being in the exercise world, I look at it as, providing a healthier body has got a better chance of dealing with this, or I wouldn't say prevention so much, but if you were to contract it, dealing with it. And let's step into that world. Let's say that somebody, that's physically active, that's in good shape, whatever, but they do happen to contract it. What are you telling your patients to do? What's going on there? Well,
if you're positive, first of all, quarantine, stay away from other people. We are using a telephone triage system to monitor patients at home initially.
Sure.
And the main symptom that we're monitoring for is their respiratory function.
Right.
As you know, in the media and everything. But when you're having trouble breathing, that's when you need to go seek care. At your
Great.
local hospital.
Yeah. I'm so glad you pointed that out, because that's been a question a lot of people have had, because we're hearing that, healthy and showing symptoms or testing positive, quarantine. But that's kind of the big red flag, isn't it? The breathing problems, right?
Right. Because there are people who, that they're on the news as well, where people are contracting the virus and basically treating themselves at home.
Sure.
And there's a large percentage of those people who do just fine.
Right. Okay, great. I tell you what, I want to pivot just a little bit, if you don't mind, because there's something we've been hearing a lot about during this time, and I know it's been around for a while, but now with the onset of COVID-19, you're hearing a lot about telemedicine. Can you give me the kind of the kindergarten version of that? Can you give me a basic explanation of telemedicine?
Telemedicine is up and coming
Okay.
right now. It is use of services using video, where a physician and a patient recognize each other and communicate through this medium to diagnose and treat illnesses.
Sure. Okay. How effective has that been? I mean, I know that with the onset of COVID-19, you guys have been kind of pushed into that. Is that right? I mean, I wouldn't say, I don't mean rudely, but I mean, that's been a big part of your practice.
I did my first telemedicine conference a week ago yesterday. So, yes, we have begun it, and to date it's going well, and I believe it's being well received.
Sure. Good. Well, and we're seeing this. I've got about a minute or so left in the segment, but real quickly, we're seeing these changes. This is something that's changing our business. I mean, we've done online training for the past couple of years, and right now we're doing massive amounts of it with our current clientele, and we trained 52 clients online yesterday. Do you see this actually making a possibly permanent change in your practice?
Definitely. I believe that if it's well received by the public, which so far it has, and we can be reimbursed for it. I believe it's gonna be a game changer. Sure.
See, well, and as I guess as people like we're seeing with online training get more comfortable with it, then I think it would be a significant part of your. I'm guessing a significant part of your practice.
Yes. I mean, I could definitely foresee that as well.
Sure. The one other question I have, and it happens to be a big topic of the Personal Edge Fitness Show because it's a big part of my life, and that is hydration. And that's something I've heard come up in talking about dealing with COVID-19. What tips do you have for us there?
Well, if you're ill, a lot of times you have a fever, you lose moisture through sweating. Those kind of things, definitely, it's important to drink fluids and treat fever.
So that's pretty much with any kind of sickness then, right? A lot of them.
Right.
Okay, I got you. Fantastic. So anything that I forgot to mention, and don't bring up anything from our juvenile past there, Hoss.
I think you're covering it fine.
That's good. So, in other words, folks, to be clear about that, I've got dirt on him too. So, listen, Dr. Williamson and Ivey, my brother, thank you so much for joining us. I appreciate you being on the show with us, pal.
It's been a pleasure.
Talking about COVID-19 now, the reason I wanted to bring this up tonight, of course, it's a hot subject. It's the elephant in the room right now. But other reason I want to bring it up is that there's so much you can do to bolster your immune system. Not change it, but literally bolster it. And exercise is a big part of that. And so speaking of that, we're doing a lot of that right now, believe it or not. Now you may say, okay, wait a second. You're a personal training facility. How are you doing a lot of exercise right now? You're supposed to be shut down, and we are. Our facility's shut down. We don't have anybody coming in our doors because we're doing what we can to help flatten the curve in more than one way. And of course, one is not having our clients coming in right now, but also taking care of our clients and all those that are interested in continuing to exercise, which is what the CDC recommends that you do. And why? It's very simple. And I'll get into some more details about this in a minute, but very simple. A healthy body got a better chance of surviving any kind of ailment or any kind of sickness. And as you let your body become less active, you get atrophy set in, plus being sedentary, several other things that are going on at this time because of this change that we're all making. It's why maintaining exercise is so important. Let's have somebody else come on the show that knows a little bit more about exercise than I do. So I'm joined now by Dr. Lori DeLong. Lori is the Dean of Health and Sports Sciences at the University of Mobile. And actually we have a good relationship because we work with University of Mobile with we've had many of their graduates not only go through our internship program, which we're blessed to be involved with them, like we are with South Alabama. But we've had, like with both those fine institutions that we have here in Mobile, we have hired trainers from both of those organizations, both of those universities. And so, and Dr. DeLong has been an incredible asset in that field. So I'm so glad to have you on to talk about this particular subject. Welcome to the show, Dr. DeLong.
Thank you for having me.
I appreciate you being here. Now, I'm hoping I'm not catching you too busy, and I'm not saying you're being lazy, but you guys have got some changes going on at your school right now, too. Don't quite so?
We have taken all of our courses online for the rest of the semester, so it has gone from in-class lecture to everything being presented online. Quite interesting.
I'm sure, very much so. I think the magic word for all businesses right now, and all institutions for that matter, is bandwidth. Lots and lots of bandwidth. But I was just telling listeners, and I've talked about this before. I've talked about this when we've talked about the show on stress. I've also talked about it, believe it or not, when we've talked about the show on breaking down and building muscle, and I'm sure you would understand why. But we've discussed the immune system, and the immune system is of course a hot topic right now, dealing with COVID-19. But can you tell us a little bit about, as far as dealing with the immune system, and why the CDC is recommending that you stay active during this time, even though we are pinned up. The recommendations for staying active, how does that play a part?
Well, when we look at all the benefits of physical activity, if you look at even the major diseases, and you're talking about your immune system, a lot of times physical activity is what's often encouraged and prescribed, for lack of a better term, to deal with cardiovascular, hypertension, diabetes, all of those things. So when we're going into something like this with an unknown, boosting our immune system through physical activity, not only for our health, but for our anxiety, our improved sleep, all of those things.
Right.
If we're more physically active, those things are just going to look to improve. And so I think that's one of the big things. It's why right now, instead of being a couch potato and binging Netflix, get up and be active.
Absolutely.
And enjoy the beautiful weather that's been outside. Yes, we are distancing ourselves, but go for a walk through your neighborhood. You don't have to encounter others to enjoy, just a good physical activity, walk, get in the yard, do some gardening, some yard landscaping. Just be active at this point, up and moving. Right.
And it's interesting that you bring up a couple of things there that you brought up. First thing, you brought up the mental. I want to get to that in just a second, because I think that's one of the most important things. But the opportunity to be so sedentary right now, and how detrimental that is. I mean, this is something that I'm preaching to the choir here, but this is something we talk to our clients about all the time, about how quickly you can lose the great health that you've built up.
Most definitely. And I'll be the first to say, I know that a lot of us are working from home, so we're sitting in a chair in front of our computer, unfortunately, for 6 to 8 hours right now, where if we were at work, we'd be getting up and we'd be walking to another office, we'd be walking to the copying machine, we'd be walking somewhere doing something. But right now, unfortunately, because of this time, we are sitting so much. So I love my phone and my watch, because it alerts me every so often when I've been sitting too still.
Fantastic, yeah.
And, those type of things we need to use now to be catalysts, to get us up and moving, to schedule some breaks, to do the things we'd normally do in our offices that we're not doing right now.
Right, exactly. Now, okay, I'm going to bring you back to your classroom a little bit here, because this is something I remember from my classroom, and the whole reason why I have a degree in the field, and it makes a huge difference between that and just a certification. But going to you have a PhD in kinesiology, so talking to your students about breaking down muscle tissue and trying to make your body stronger. What point or what timeline would you put? And I'm not gonna. I've got one myself, but you may have one even more accurate. But what kind of a timeline do you have between the stopping or ceasing exercising and the onset of atrophy?
Do you want to go with the coach in me's theory, or do you want to go with we've heard it for I'm going
to go with what first came to your mind, because I trust. Not only do I trust your education, but I trust your gut on this.
I've always been told within the first 48 to 72 hours of inactivity that you begin to lose some of it. And so, as you progress through that, and the longer you sit, the longer you're sedentary, the quicker your muscles just going to begin to break down, because if you don't use it, you lose it.
Yeah, bingo, exactly. I'm sitting here, I don't know if you're seeing me on Facebook, but when you said 48 to 72 hours, I'm over here celebrating. I mean, I would be breaking out the champagne. And the reason I say that is that listen, I'm like everybody else. I would love for it to be, I got all my strength and I just keep it for the rest of my life, and that'd be fantastic. Of course, I'd also be out of a job, but everybody will be a lot healthier, that's for sure. But it does begin, like you're saying, between 48 and 72 hours. That's something we talk to our clients about, and that's got to, you start to lose that muscle tissue, and you start to go into the sedentary lifestyle like you're talking about. All of us being quarantined, I have to believe that you're creating a fertile field for the onset of a virus, or easier to contract, or at least more difficult to mitigate it if you were to contract it. Am I right?
I definitely agree. And I think sometimes mentality is the perception is physical activity is you have to go out and jog, run,
Right.
you have to do those type of things, and that's not what you have to do.
Sure.
Just, housework, vacuuming, ladies,
Right.
give you some physical activity. Getting online on one of your programs definitely will give you lots of physical activity, but it's important as we age that we are active and we are weight-bearing and doing things that's going to make our bones and muscles and our heart stronger.
Period. Maintaining it, and of course that's going to help us deal with this. Now I want to get back to one of the subjects you brought up a minute ago, and I don't know if you and I spoke of this prior to, but you brought it up, so I'm throwing it back at you.
Sure.
But I'm a big, and I've talked about this in my series on the what I call the live aging, and everybody that heard that series, and I've got that. If you haven't heard that, I've got it on our podcast, and it's a 5-part series dealing with the live aging. It starts with the introduction, and then it talks about what I call the 4 components of ability, and the 4 components of ability are fitness, nutrition, lifestyle, and the most important, the one that I say is really killing us, which is mindset. Now, when you talk about the mental aspect of this, of being closed up and home, where were you going with that?
Well, I believe a lot of us are watching updates or watching the news or clicking on whatever we find to get the latest updates, and I believe that's just making us more and more anxious. We're waiting, and like you said earlier in your show, let's be positive about this. Let's be positive about change our mentality a little bit as far as what are some of the benefits we're seeing from us being with our family more, being more physically active.
Right.
The mental aspect of this is going to be really huge, I think, in the next few months. We're going to see a huge fallout from that. In fact, I just read an article the other day that the mental fallout may be somewhat comparative to the physical by the time this is all done. So I think that the anxiety, the stressors, the lack of sleep,
Right.
those type of things are going to begin to affect us, and physical activity is just going to help mitigate some of that.
Right. Well, and I can't agree with you more. This is something that when I talk about the mindset part of the live aging, I talk about the fact that if you constantly believe you're going to deteriorate, well, you're going to deteriorate. And it's amazing how powerful the mind is. I mean, it can make you do amazing things, and it can, I hate to put it this way, but it's so true, it can literally kill you. The fact that you've got financial stresses. You've got the stress of children being at home, the stress of looking at what's the future look like, homeschooling, this kind of thing. So somebody told me the other day that noticed their neighbor scratching off their bumper sticker that said, "My child is an honor student." Now I don't know what that's all about, but it's just kind of interesting that's happening at this particular time. No, I don't. I mean nothing tough about that, but it makes it stressful. And so the mental challenges, like you say. I mean, I would have to believe that counselors' offices are going to be quite busy if they're not doing like the telemedicine, like I was talking to Dr. Williamson a minute ago about. I mean, that's going to play a huge part into it, and I agree wholeheartedly with what you're saying there. Definitely. Any other recommendations you'd have for our listeners?
I agree with you about the drinking of the water. I think that's even come out as part of a defense against this, that to stay hydrated. We don't know for sure if this is going to be airborne or not. So the more water you drink, the more you're washing it out of your system. Right. Being active and then embracing this time with your family and the loved ones that are close to you.
I think that's fantastic. I love hearing you say that, because staying positive in all this is going to be critical. It's going to be critical, and you got an awesome opportunity to, like you say, spend. That's a great way of looking at this. You got an awesome opportunity to spend more time with your family. There is a positive side of this, and come on, okay, I'm speaking to a PhD here. We're gonna get through this, right?
Oh, we are.
No problem.
And we're going to come out stronger than ever.
Absolutely.
As you said earlier, all the things that we've faced as a nation, we always have.
Right, exactly. I can't agree with you more. So, Dr. Long, thank you so much. Look, first thing, thank you so much for the involvement that you have with personalized fitness and your students and the internship program, which has been a joy for several years now with personalized fitness. And I sure appreciate you being on the show. Don't be a stranger. We'd love to have you back.
Thank you, and I appreciate it. And hey, I want to give a shout out to all the physical education teachers in the area.
Oh, awesome.
I want them to know the first 2 days of me doing physical education with my 3rd and 6th grader from the programs they've sent out via online stuff.
Yes. That's
no joke when you're trying to keep up with that age group. So
I'm sure.
I really want to say thank you for all those teachers out there that have done a great job in encouraging our kids to stay active during this time as well.
Fantastic, and you just did. That's awesome. Thank you so much for adding that. I appreciate it.
Thanks, dear.
Let me let you know what we're doing at Personal Edge before I have my next guest come on, because I wanted to talk about nutrition in this also. But let you know what we're doing at Personal Edge to deal with that. Now, we are flattening the curve like everybody else is. We have nobody coming into the facility, but we're flattening the curve 2 different ways. Not only are we keeping our clients out of the facility, but we're continuing their sessions because we're training online. Now, this is something we've been doing for the past 2 years with our out-of-state clients. In fact, we also do it with our Catalyst program, and that is actually one-on-one live sessions with our clients. And so we're actually doing working out through a simple, either through an iPhone, iPad, a computer. There's so many different ways of reaching out to people. And you can do it with little to absolutely no equipment. I had one of my best workouts yesterday morning with somebody a client of ours that had no equipment whatsoever. None whatsoever. And I think she is still, let's say she's still commenting on me today as far as her workout was concerned. It went fantastic. But we're helping them maintain their level of wellness and maintain their fitness level during this interruption. And not only is it good for your physical, it's also fantastic for the mental. You've got that interaction. You're releasing in those endorphins. And like Dr. DeLong was saying, how important that is for longevity. If you're interested in doing any online training, they don't have to be a member. Contact us at area code 251-341-0927, or feel free to contact us via our website, personaledgefitness.com, and Facebook. We've had some people reach out to us on Facebook that were interested in doing some training, and so you can reach that's Personal Edge Fitness on Facebook. We've got a messenger tab there. Tap that and contact us. We'd love to set up a phone consultation and tell you how incredibly easy this is to do, just to kind of maintain your fitness level. So we're very used to doing this. We counted it up. We did 52 sessions yesterday. Today was another busy day with that, and we're more than glad to. And if you have a company where you've got a lot of people sitting at home, we'd love to work with you. We were actually working with one of our companies right now that we do corporate wellness, where we're setting up a boot camp that we're doing with all their team members, but their team members are at home away from each other, and we're actually doing a boot camp together. And the other neat thing about it is if you have a friend or relative that doesn't even live in the same city, state, or nation, you can actually do a workout with them by doing it online. It's a fantastic opportunity to, instead of getting up and traveling right now, which we shouldn't be doing to go see family, this is another way of doing it and staying active and staying healthy, flattening the curve. Again, that's 251-341-0927 or personaledgefitness.com. Now, I've had her waiting for quite a bit, but I couldn't do this, and I wanted to stay positive on this show. And if I'm going to stay positive on this show and talk about health, wellness, or nutrition especially, then I'm always going to have our good friend, registered dietitian, Lynn Barnes, to talk a little bit about immune system and dealing with this crisis through nutrition. Welcome to the show, Lynn.
Hey, everybody. How are y'all doing? Good to see you, Garrett.
Great. We're so glad to have you as well. And I just heard a scream from outside. Everybody's so glad to hear from you, Lynn. Absolutely.
I heard that too. I'm not sure what that was.
Lynn, as I've said before, I was going to actually talk a little bit about nutrition, because nutrition plays such a huge part in everything we do, but especially in dealing with the immune system. But as I've said before, I don't like to finger paint when I've got access to Michelangelo. Dealing with a crisis like this and dealing with the immune system, what should we know as far as nutrition is concerned?
Well, this is a tough time in that if one is ill, then quite often their normal appetite is not in place.
Right.
For whatever reason. I was sharing with you, if one has a fever, that usually makes us feel ill or bad,
right,
and our appetite's affected. But it also increases your metabolism by about 7%.
Oh, wow.
So, yeah, that's really a lot if you think about it.
That's
and
significant.
I was also reading up about fevers, just to refresh my memory. Fevers can last from 2 to 3 days to 2 to 3 weeks.
Wow.
And that's a game changer on your metabolism if
Massive.
you're not doing very well with replacing.
Right.
Remember those times when you fall asleep and you had a fever and you woke up and your clothes are just drenched?
Yeah, exactly what you're talking about, yes.
Okay, well, the body loses about 34 ounces of water in an hour.
Oh, wow. That's a massive.
Yeah.
I had no idea. That's a massive amount.
How that compares, but I know before that happened to me, and it scared me. I thought, oh, my stars, this is not good,
Yeah.
So, anyway, I just wanted to throw that out there. And I also wanted to say, and I know we want to talk about nutrient intake. But
Well, I'll tell you what.
throw this
Excuse
out for
me,
people
one
who
second
might be
before you
dealing
move
with
on.
this.
Before you move on to that, Lynn, let me stay on that water subject just a minute more, if you don't mind. And because not because it's just one of my favorites, but you said something there I've never heard. I mean, in that situation, 34 ounces of water in an hour. Think of that, and the fact that 70% of adults don't drink enough water in the first place. I mean, that's got to wreak havoc on your system. I mean, that's got to drain so much blood supply. It's got to affect organs. I mean, am I wrong about that?
No, and think about it this way. Once you're dehydrated, your body fights to keep the proper core body temperature.
Yes, absolutely.
And when you are dehydrated plus a fever, one is overheating, that's when it becomes dangerous.
Oh, my gosh, yeah, to say the least.
And I know on this show we've talked about people who may like good foods or bad foods. This is not the time, if one is sick, to be concerned with any of that.
Oh, wow.
Your concern needs to be with finding something you can tolerate that provides calories, hopefully protein and carbs, and just work on getting it in.
That's fantastic. Thank you so much. I really appreciate you adding that in. We're actually, believe it or not, we've burned up a lot of time here, but we got about a minute or so left. But I want to touch on, make sure you hit what everybody needs to know as far as the nutrition. Don't let me leave anything out that is important.
Well, when one is older, and I know this coronavirus is affecting older people more.
Right.
You don't usually have as much muscle, therefore you don't have as big of an appetite.
Right.
And you don't absorb as well.
Right.
You see the picture I'm painting here?
I see exactly what's going on there.
Disadvantage.
Yeah. Right. Slippery slope.
So throwing in something like this, the elderly needs to be very concerned with eating well.
Sure.
If you can't eat your food, can you drink some nutrition?
Fantastic.
At this time,
absolutely.
That's where a lot of these things come in. So just to think about that, to make sure you are well aware that this can be a very challenging time to get the right amount of nutrition in.
I can't agree with you more, and I wish we had another half an hour to go on this. We're coming up on the end. Lynn, thank you so much for joining us.
Thanks for listening to the Personal Edge Fitness Podcast with Garrett Williamson. Subscribe now and be a part of the show by calling 251-278-EDGE or message us on Facebook and Instagram at Personal Edge Fitness or at Team PE on Twitter, and visit us at personaledgefitness.com.